Hello, today we are going to discuss the topic that I have chosen is respiratory system examination. How to examine a patient when you are asked to do so in examination hall. The respiratory system examination, like the examination of any other system, includes 4 steps. Number 1, inspection. Number 2, palpation. Number 3, percussion. And number 4, auscultation. So in case of inspection, once we are going to examine a patient, first of all you have to be sure that patient is in the appropriate position. The appropriate position is a supine. The patient is lying at 45 degrees angle and the chest should be exposed properly. Take the shirt off. In case of female patient, leave the undergarments on. And have a general look of the patient, introduce yourself and ask the patient's name, and after that take a consent, start the examination. General look would include if the patient is having any kind of cachexia, any easy appearance, breathless to you, is tachypneic, he is synoptic, he is having nasal cannula, oxygen mask, oxygen cylinder nearby, or sputum pot nearby. After that, the inspection would include inspection of the chest. That would include the front of the chest, the back of the chest, and the sides. That should not be ignored. The front of the chest, you will look for any deformities like any elevation or depression in the chest. And number 2, you will be looking for kyphoscoliosis. Number 3, you will look for pectus excavatum or carinatum. Like any other area, like abdomen, other area also of the body, will look for any skin changes like telangiectasias, pigmentation, scar marks, puncture or tape marks, any chest tube, for example, patient is having any prominent veins, ulceration, wounds, any other thing like this abnormal that you see. And if there is any chest intercostal indrawing of the chest, that will show that patient is using excessive muscle of respiration. So you should be observing for that. Above all, during inspection you should look for the shape and size of the chest. For example, if the shape is barrel shaped, the patient might be having underlying COPD. That might give you a clue about the diagnosis. The size, if the patient is having a small size chest, might be due to, if the patient is not related to the age, it can be due to the underlying pulmonary fibrosis. The next step, we move on to the palpation. The palpation would include, first of all, the 3 areas in the neck that you will check. That will include number 1, tracheum, that you know as 1 finger, 2 finger, 3 finger method, and then precosternal distance, that is usually a 3 finger distance that can be reduced in certain diseases. And number 4, the lymph node in the neck, and supraclavicular you will check, also axillary lymph nodes. And after that, the palpation of the chest would include to check for the tenderness, crepitus in case of the emphysema, subcutaneous emphysema, and then chest expansion, that you would check in the I would write here in apical area. Number 2, supramammary and inframammary area. And then in the end you will check for the vocal fragments. We will discuss some other video that which causes increase or decrease these certain parameters that we have discussed. Then percussion, and also during percussion you have to you should know the exact method how to percuss, putting your left hand firmly across the chest and using the other middle finger of the other hand to tap twice, and comparing the both sides is very very important. On the front of the chest you will come across in the right side the area of the dullness, that is because of the liver, usually in the 6th intercostal space in the midclavicular line. The left side you might come across the cardiac dullness area. This is the point where you will move towards the lateral side and check the lateral side also, comparing the both sides together. After percussion, you will quality of percussion note. The area can be dull, stony dull, resonant, hyper resonant, like that. So compare both sides. After that, auscultate in each area of the chest, and usually the regions are tested: supraclavicular, infraclavicular, supramemory, and then inframemory, lateral side. Also, don't forget, all these steps should be repeated on the other side. You can start from the front and go to the back, or start from the back and go to the front, also during the lateral side. So the auscultation, you will check for the breathing pattern and breathing type and any added sounds. And number 3, and not the last, not the least, is the vocal resonance. You should check. So after you have done this, depending upon the findings you have, you will go on to have the relevant examination of the system, whatever depending upon whatever finding you get. And thank the patient in the end. Sanitize your hands. And then you are ready to describe your findings. We will discuss in some other video. In auscultation, two other terms are used. One is whispering pectorality. An added sound, it comes in the added sound and the plural rub, or you can find these things like when you are examining the patient. And so these are the 4 steps that are we usually use in any system to examine, and we have today discussed about the respiratory system examination. The other day we might discuss some other system, and we'll catch you later.